Welcome back. There's new confusion this morning over something we've been hearing a lot about: face masks. There are new reports that the CDC is now considering changing its policy and suggesting Americans wear masks when we're out in public. But this morning, the Surgeon General says not so fast.
A major way that you can get respiratory diseases like coronavirus is by touching a surface and then touching your face. So wearing a mask improperly can actually increase your risk of getting disease. It can also give you a false sense of security.
Help us out here, and we've got the right man to do it. Joining us now, Dr. Thomas Frieden. He is the former director of the CDC. Doctor, your reaction to the Surgeon General here?
I think the Surgeon General is just right. We shouldn't have a false sense of security by wearing masks. There are things that each of us can do to reduce our risk and help other people be safe. Those include washing our hands regularly, not going out if we're sick, covering our mouth and nose, and importantly, making sure that if we are sick, we seek care carefully. In that situation, it's important to wear a face mask. But here, our key has to be protecting people on the front lines, the doctors and nurses and transporters, people who are there to save our lives. And right now, there is unfortunately a shortage of respiratory protection for them. They're first online.
Well, you've got an op-ed out calling for the Surgeon General to write a letter to every American. Why and saying what?
I remembered in 1988, more than 30 years ago, when Surgeon General Koop wrote to every American. I was working as a medical resident here in New York City. I was treating hundreds of patients who were unfortunately dying from AIDS, and the government had been silent about it. And Koop courageously told people what they needed to hear. I think now we need to hear, frankly, what people need to know, and every American needs to know that. And we thought it would be good to include a digital thermometer in that. Who's thinking about digital thermometers? They're going to be needed in every household and in every building. I'm afraid that this approach in parts of the administration is running from one thing to another without a systematic, coordinated approach. We think about ventilators, we think about N95 masks, we think about test kits, but really what we need to think about is a comprehensive approach to reduce illnesses, deaths, and economic harm.
When I hear your voice, when I see your face, it takes me back. There was a time in history when you were at the head of the CDC when we heard a lot from you. As this pandemic worsens, does it surprise you that we haven't heard more directly from the CDC?
I'll feel much safer when I have confidence. The CDC has a place at the table and also a place at the podium. I was just now looking at what Dr. Nancy Messonnier has said about this in January and February. She was exactly right. And unfortunately, I think that angered people in Washington, but you tell the truth. You treat people as the adults they are. You say, yes, something bad is coming. Yes, you should prepare. We should be humble, she said, because there's a lot we still don't know about it. If you go back to see what Dr. Messonnier said, and when she said it, it was exactly right. And that's the kind of messaging we need regularly. And that's the kind of planning we need regularly. Everyone is asking, when can we open? That's not the most important question. The most important question is, what do we need to do right now so we can open as soon and safely as possible?
Talk to us for a moment about Corona hitting emerging markets, hitting the developing world. There's an article on foreignpolicy.com talking about how social distancing is a privilege. There's day laborers in India who have said staying home means putting their children's lives at risk.
My organization, Resolve to Save Lives, is privileged to have received some funding from Bloomberg Philanthropies to augment the work that we've been doing for years in Africa to prepare for and respond to pandemics and epidemics. And we've just finished a phone survey in one country. And one of the questions was, could you stay home? And the answer was, yes, I could stay home, but I would starve.
When this thing hits places like Africa, how scared are you on a 1 to 10?
I think we need to be as prepared as possible, not only because this could cause terrible devastation in places that don't have enough doctors and nurses, and we're seeing doctors and nurses killed by this, don't have much capacity for critical care or even oxygen support for patients who are having trouble breathing, but also recognizing that we really are all connected. Whatever happens in any country around the world affects all of us. That's why it's so important we use every moment to prepare ourselves, to get our healthcare systems ready, to prepare our public health systems for contact tracing, isolation, quarantine, mass testing approaches. All of this is essential. We need an all of society, in fact, an all of world approach.
Dr. Frieden, thank you for your expertise. Thank you even more for your work. I appreciate you joining me today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.